everyone, and welcome to another edition of Clock Talk with Dr. Greg Brannon. As always, 15 minutes, chock full of information. So today I thought we'd do something a little bit different. We've received a list of questions from some of our patients over the last couple of weeks. So instead of focusing on one topic for 15, we're going to kind of go around across the board and talk about multiple things as it relates to hormone replacement therapy. So question one, explain the science behind how BHRT can benefit active military service members.
That's very interesting that comes up because there's actually right now in Congress a bill called the operative syndrome. These operators, the stress they're under is insane. And we have a lot of patients that are involved in this. And you think about it, Jim, they're doing things that are physically and mentally the top of the top. Again, it goes back to what is the most abundant fuel there is. Now, it's very interesting. I use a range for men of 900 to 1,400. Greg, where'd you get that range from? There was a study done in the 1940s on Army recruits, that exact population base. And it was 900 to 1,400 for the average guy joining the Army. And I mean, well, side note, I watched a movie yesterday called The Last Rifleman. I could not, you want to watch a movie about that generation. It's the greatest, right? So that generation is insane. Today's soldiers, besides being physical professional athletes, they're computer whizzes, under being shot at and stressed at, right? So their levels are, we've talked before, cortisol and testosterone they're inversely proportional. So when you have high stress, you drop that. So I have men that come to me. Now, a range should be, by today's standard, is 264 to 916, okay? 7 years ago, the same WOMAC study was 348 to 1197. And nobody recognizes why has it changed. And I go back further, same hospitals, 900 to 1,400, got it. So what happens to your system if you're operating at 20% of max? And that's what happens to these young boys. They look like Hercules. They're quick as crap, but now at home, they're losing to their wives. They're losing their brain power. And I got a guy today called me who goes, Greg, 33 years old. He goes, like, how'd you hear of us? All his buddies come to us. I'm losing motivation. Okay, and you think about it, a 33-year-old guy, what's his lack of motivation? He's in the gym 2 hours a day instead of 3 hours a day. You know, you can't, so I don't want to judge him to the normal guy.
Right.
But they know they lose words. They're tired. So you looked at, I started studying a lot of TBI and PTSD papers. The brain sits in this thing called the optic chiasma, which is bone. And the hypothalamus, and then the pituitary hangs underneath that. There's no place for that to move when it gets shook around. So that's why when trauma happens, the hormones go down. But there's 6 hormones in that area. The first 2 that go down are growth hormone and gonadotropins, which controls testosterone. So operator syndrome is, I think, under high stressful situations with 20% of testosterone. We know, again, by doing hundreds, if not thousands of young men, that when they get to levels in optimal ranges, their symptoms go away and they perform better at work and at home.
On top of that, too.
Well, the good part, Jim, is they have a higher dementia rate as they age. Maybe we avoid that. They have concussions, TBIs. If their brain has enough fuel to prepare, because what happens, testosterone, there's a couple things in the brain. It makes more brain called neuroplasticity, and it makes the synapses tighter. So, in fact, the treatment now that we know for TBI is not to mask it with medications, but to give testosterone a growth hormone.
Mm-hmm.
And that's what we do.
So is a higher incident of dementia and
concussions in general.
Concussion, yes.
And a lot of those boys just have concussions. I even know they have concussions, right? You jump out of airplanes and helicopters and you have bombs going around.
Right.
But again, it's their high level. I can't stress, Jim, not because I know these young men. I know your son was in the service, is how much computer work they do. And they have machinery in their head that are looking at virtual, they're looking at augmental, all at the same time. It really is amazing what the brain can adapt to. But when you're doing it with 20% of what they used to have, there's got things that the system's going to fall down.
Yeah.
And I think the most important part is I had the honor of delivering a lot of babies in our military, is that it's a family thing, not just not that one man thing. But we have to give them all the health care possible and give them the opportunity to heal. Not when they're done with their work, see you later. Got to take care of them that whole time. That's something we have to do.
On top of that too, I mean, their natural training and or deployment environment is full of toxins
every day.
They're encased in plastic.
Vietnam, Agent Orange, right? They're exposed to that as well. We don't know till later on what occurs, but we should do one thing is listen to them. They know their body extremely well. And if they're telling us they're off, we can't say, oh, you're 265, you're within range, you're fine. No.
Yeah.
Let's find some answers. But I have thousands of men. In our new book, Restore, we have a SEAL Team 6 member tell his whole story of brain concussions, and he went to Walter Reed, all kind of stuff dead. But what got him over the edge and got him back, now he got his master's of cyber security, is getting his testosterone levels in optimal ranges.
Amazing. All right. Military out there. Keep coming.
I love them.
Describe the role that hormones play in treating autoimmune disorders.
Okay. Autoimmune is a very interesting topic, Jim. Again, these are new things in this last few generations. Why does your body attack itself? That's very, very important. But you know, the way the body works, again, we talked before, the testosterone and estrogen are very involved in the immune system. Women in particular, they have a function of carrying life in them. That baby, that placenta is genetically not theirs. So therefore, the proteins that baby make is not theirs. So why don't they reject that baby? Like if I took my heart out and stuck in you, you'd reject it. Because the immune system has these things to protect the mom. So it's very interesting. In a woman's cycle, her immune system actually changes during the cycle. She's less immunogenic when she's ovulating because more chance of implantation occurring. What's very interesting is but when they have response, women have more of an autoimmune response because they have estrogen leads to a hyper response to autoimmune diseases. So the question, I don't have an actual reason why. Part of my theory is a lot of our vaccines are made in aborted baby cells. So that's how the body's exposed to human cells. They're called diploid cells. That would be a reason. But we know this. At the immune cell level, you have these, I'll say the turning on the immune system and turning off the immune system. Interleukin 1 turns it on and interleukin 10 turns it off. It's simplistic, but that's how it works. Is that the hormones balance that properly. When your hormones out of whack, you lean more to the inflammatory state. And inflammation is the root cause of all diseases. That's the problem. So you're trying to decrease that oxidative stress. So I think that's part of it, Jim.
Okay. How do endocrine disruptors influence the risk of developing hormone-related chronic diseases?
That is optimal bio. That's what we do. Okay.
Right.
That's a great question. So testosterone, I know I repeat this all the time, but testosterone becomes estradiol. Again, estradiol is an intracellular hormone that's caused from testosterone. Got it. There are 3 ways it leaves the body. It's got 2, 16, and 4. Got it. When you get an endocrine disruptor, probably the most potent is called phthalates. pH, with the pH, but it's not phthalates. That does a couple things. First off, it blocks testosterone formation. It increases aromatase, which is the enzyme that makes estrogen work more potent, and it mimics estrogen. So there's everything possible to make a hyper estrogenic state. And that leads to the neuroendocrine dysfunctions. That's what it does. Because we have that homeostasis between all these hormones. When you're skewed to one or the other, that messes the whole system up. And microplastics, phthalates, atrazine, Roundup, all the PVC piping, all these things are the disruptors. And think about disruption, Jim. It's not just in the gym. It's in the womb.
Yeah.
It's in the womb. The placenta cannot filter stuff out. So however a testicle or ovaries are being formed, it's being formed improperly at the beginning.
Somebody said the other day that they're terrified of eating fish out of the ocean because of the phthalates, which then led me to wonder, Jesus, farm-raised fish better than natural fish?
I still think farm is more contaminant, but there is a lot of problem. There's a crazy study done a few years ago. And they went to restaurants in New York, and they did genetic testing of the fish. Tapia, salmon, tilapia, salmon, whatever it's supposed to say it was. It was like 95% was not genetically the fish it says it was.
Really?
That's how contaminated our GMO fish are, right? Mm-hmm. So I don't know, man. And trying to feed the world, which is great, get me right. We're doing things, I think maybe going back to the old ways of doing things might be better in the long haul. And I understand the volume part of it, but we got to do something on that, Jim, because these molecules our body's not exposed to. Not healthy.
Hopefully we have some pick-me-up questions soon. How do fluctuations in cortisol levels affect the risk and progression of chronic stress-related diseases like hypertension and metabolic
Okay,
syndrome?
the anterior pituitary makes 6 hormones around the body. The posterior makes 2. So there's 8 between us. What's very interesting, when those, in the anterior pituitary, when those 5 hormones are functioning properly, ACTH is the 6th one, that makes cortisol. That's usually in sync. It's very amazing. All steroid hormones are made from the precursor called cholesterol. So when you have enough cholesterol, it will go down these avenues to make the product it needs to make. And so cortisol is inversely proportional to testosterone. So under stress, your cholesterol becomes more cortisol and becomes less testosterone. So when you're actually not in stress, your body can actually make more testosterone than cortisol. Cortisol is this pattern where it peaks at about 8, 9 o'clock in the morning, goes down through the day, goes down very low when you're sleeping, because when you're sleeping, you're making your testosterone. That's the whole benefit of that. So any stressful situation, emotional, physical, will throw that curve off and push that body. But it's very interesting though, Jim, even at high stress, most people's cortisols are within range. We test that cortisol via saliva we do 4 periods a day to get a curve. And to fine tune that, there are some adaptogens that help do that when you find that patient. But keeping everything in homeostasis really helps the cortisol. The key thing is sleep. I can't stress, the most important thing is real 5 REMs of cycles of sleep is the best important thing.
And BHRT helps with your sleep.
Testosterone keeps you asleep.
Yeah. I wish it kept me asleep for 8 hours instead of waking up 3 every
We're
time.
old. We're also old.
How does insulin resistance contribute to the development of type 2 diabetes and other chronic conditions like cardiovascular disease?
Okay, so cardiovascular disease is an inflammatory disease at the endothelial levels. So sugar is the culprit of that. So diabetes is interesting. Type 2 diabetes is, well, there's type 1 diabetes. These called the beta cells of Langerhans, makes no insulin. So you have no insulin. Type 2, you make too much insulin, but the receptor sites are oversaturated. And so what you want to do is reset them. There's studies showing that testosterone actually makes the receptor more sensitive, so therefore decreases hemoglobin A1C. So what you want to do is, a study out of Germany shows that they had type 2 diabetics given insulin. Within 6 weeks, 34% were in remission. And when you restart their normal, get off the testosterone, it comes back. So bottom line, it makes the receptor site more sensitive to do its function.
It's kind of analogous to K with vitamin D.
Yeah, well, sort of. Vitamin K2, K1 is for clotting, K2 is for calcium metabolism, and that's why you take them together, because it helps the absorption and the So it keeps the calcium balanced properly.
Mm-hmm. Okay.
But again, bottom line is, when you don't have that, Jim, again, you lead to inflammation. Extra sugar, diabetes. Sugar is a glucose molecule, is very sticky. So is fructose, very sticky. And when they stick, it causes oxidative stress. So the goal is to have less as possible. That's when you measure hemoglobin A1C, you're measuring the glucose molecule that's stuck to red blood cells. But by the way, it's stuck to the brain too. Alzheimer's is also called type 3 diabetes. Sugar is the culprit.
And all forms of sugar.
All forms of sugar. Starches, carbs, does not matter.
What is the role of estrogen in protecting against or contributing to chronic diseases such as osteoporosis and, again, cardiovascular disease?
Good. Well, we were talking about that a few podcasts ago, but the bone is very interesting. Our skeleton, about 25% of our skeleton is remodeled every single year. Calcium itself is used for a lot of other metabolic pathways. But you can't have the calcium float around in the blood because it'll clog everything up. So it's stored in the bank. The bank's the bone. So testosterone and progesterone make bone. Estrogen controls the reabsorption of bone. So you want to make it and reabsorb it after you use it. And menopause is the worst setup. You stop making it and you stop reabsorbing it. So you lose around 5% per year. So testosterone and estrogen, progesterone all working together keep bone healthy and keep it made. There's a paper done in 1979 by the American College of Journal of OBGYN, showed that they looked at patch gels, creams, that nothing was superior other than the pellet, because it actually made 8.3% of bone per year. I have women in their 60s and 70s have more bone now than they have in their 40s and 50s.
Oh.
So the answer is it's crucially important.
All right, with 30 seconds left, what role do sex hormones play in autoimmune diseases, which often have a chronic course?
Again, it has to do with the inflammation of the interleukin 1 and 2. The bottom line is when they're balanced, you have a proper balance within the cytokines. That's the root cause of the whole thing. You want acute hormones to work at the right time, but not chronically, period. Because acute saves your life.
Right.
Chronically gets you sick.
Thanks for the rapid round of questions. As always.
I love the pressure on me. I get nervous. I'm just joking. It's really fun, Jim. I hope to be clear enough to be able to understand it's really your body, and you know what your body does.
Thank you.
Right.